being able to receive external emails. It's been another one of those things where all of a sudden it just got shut off. Well, the admin that was set 3 city managers ago was tied to, after finally getting through paperwork and all the things, it was tied to a personal cell phone number, and it's kind of been a lot of hoops we have to jump through. We've jumped through the hoops. Paperwork has been filled out. We were told 5 hours ago that it should be back on in the next 4 to 6 hours. So hopefully that will be on soon. So to anyone that's been sending emails to anybody externally to the city, we're not being rude and ignoring you. It's that we're not getting them. So I'm pretty sure tomorrow the staff will be coming into about 400 missed emails. But anyway, so that's the reason behind that. And then lastly, because of this situation, the VP from the Kittle Group had sent me an email asking what days do we want to do the groundbreaking. He reached out to my cell phone today, so he has asked me to set 3 dates that could work. He's already working with his marketing staff to, kind of help us with promotion of the groundbreaking for the apartment project. So I'll be happy to circulate an email to each of you. I would encourage you, if there's any certain dates that you would, you just know are not, workable for you, please email that to me so I can take that into consideration. Other than that, I'm excited. Last year's budget was inherited. This one, it's good. It's going to be a nice working budget. I will say again, I'm going to reiterate this from now until next year. We're going from a safe budget to a working budget. We are doing our best, doing our due diligence, researching everything, looking at the past, and there's this fear of, well, what if I go over budget, okay? Or I'm going to do what I normally do, which is, okay, I've got some money down here. We are creating a working budget so that at the end of next year, we will have a good depiction of where our costs, expenses, and the needs are. And so I'm excited. This is kind of what I would call the baseline year for the budget. Anyway, so we're almost there, guys, and I appreciate your patience. But we're setting it up. We're setting it up the right way. So, any questions for me?
So, any updates about the trash pickup?
Oh, yeah, that's, thank you. So Republic didn't think because it's new trucks, it's new technology that they've ordered to create the weekly bulk pickup. They honestly didn't think the new truck would arrive till November, but when I spoke to Robin yesterday, she said that they're actually expecting delivery of the truck any time now, like in the next couple weeks even. And so she hasn't really, so they're working on getting a marketing piece. Now, when the truck arrives, they've requested that we kind of keep things the norm for 2 weeks while the drivers, get to practice and use, and with the transition of it, just anyway. So in the next couple weeks, we're hoping to be able to send out a marketing piece announcing the new truck has arrived, and then a couple weeks after that, we will start the new weekly bulk pickup.
Okay, thank you.
Thank you for reminding me.
You're welcome. So we'll move to item number 4, B, receive and discuss the quarterly financial report for the month ending June 30th, 2025.
Good evening, Councilman and everyone here and everyone who's watching. Can you hear me now? Yes. Oh. Okay, first slide. It's working. It's not working. Icebreaker. That's what it is. You don't know. That's right. Okay, all right. I will be presenting the revenue and expenses report as of June 30, 2025. I'm always very grateful when I can bring good news. Good news is goodness. Okay. Simple fact is that we are only, if you look at the bottom line that says revenue total and percentage of balance remaining. I mean, I don't know why I'm using this because it doesn't really work. Okay, so that column over there, it says 0.66%. That's how far we are from actually achieving our total revenue. That's about 39,000 something, so that's 40,000. So that's basically 1 month of fire chief's work. That's because they bring in about 50,000 a month. I'm sure we will meet our budgeted revenue by next month. Praise be to God. Okay, so if there's anything that I want to mention, I would like to mention 2 things. This revenue source number 1 is the general revenue. As you can see, the first line, it says the year-to-date expense revenue is 4.7 something, where we budgeted for 4.5. A lot of that is actually good news, property tax. And another line that I need to mention, and you will see a different slide after, is development services. It was budgeted, so that's the 130. Let me see if this works. That line over there, 130 Development Services Department. Year to date is 321,000. It was budgeted for 180. My projection until the end of the year is 400,000. So. Good job, good job, good job. And I want you to know that currently this year we have, and I checked with Amber, Dawn, so I know my numbers are correct, we have 286 permits in the pipeline, 94 of which are new homes, and 192 will require inspections and that good stuff. But this is good news. It means that we are growing. Okay, next slide. These are the expenses. The only thing that is worth mentioning that is over the budget is the non-departmental line, and that is the 999, the very bottom there, or second from the bottom. As you can see, we are $125,000 over budget, and that is not because we are overspending. I think the budget just needed to be adjusted. The current property insurance is about $144,000, and it was budgeted for $66,000. And then if you compare to budget, then it looks like we're overspending, but I think it's just a neat adjustment on the budget, and we did adjust that for this coming year, which will reflect in your budget books. The other thing that I would like to mention is the third-party inspection expenses that will continue to go up because of all the permits that are being done. To my understanding, correct me if I'm wrong, Mr. Martin, there's about 11 or 17 inspections that need to be done for a new home, yeah? Of which for fence and sidewalk, you do in-house, right? You do it yourself. Yeah, so it's all good stuff he's still doing.
I have a question for you, Mayor.
Yes, sir.
I'm looking at the expense of the community center,
Yeah.
and I see that we still have 86% of unused monies that are still available. Is the community center being used as much? Is that the reason why the numbers are down, because less cleaning fees and things of that nature? Or is it, I mean, or maybe does Dawn know, or does somebody know where we are in as far as why that number's not tracking with what it should be?
I think it was budgeted for, first of all, I think it was budgeted for janitorial purposes. And the other thing, I did say, I think, if I remember correctly, and the other thing that we have not used is the overtime. I don't think when we moved, I don't know what happened, but right now, all the overtime for community center is unfortunately currently being absorbed by, say that again? The general, right, and it's not being allocated to the right GL. It's somewhere up there, but I guess, like, that's, I think we spoke about this a few times. What we want to do diligently this year is to make sure we do a correct cost allocation so that we know what it costs to run a business.
And that's kind of what I was going for right there. It's the only number that has like an anomaly, right? That is like
Yes, sir.
superficially way out of whack.
Absolutely.
And so it's like, I mean, really what it does is it helps you guys tweak it even more to
Yes.
make a better budget. So,
Yes,
so
absolutely.
anyway, thank you,
Yes.
Mayor.
No, thank you. And so that's expenses. Ah,
I have a question
yes, sir.
regarding the same slide that you are
This one?
on, the one that we just came from.
Okay.
All right, so under 100, under general expenses, that summary, underline item 140, 140 street department.
Yes.
So I'm seeing here, the year-to-date expenses, we have 210,000
Yes.
that we have spent.
Mm-hmm.
And the current year budget we are projecting for this year, there's 462,800.
Mm-hmm.
And then we have the previous year's balance, we have 233,753 and 21 cents. And then the final one, there's here, prior year balance, we had, that's 314,708. So with this projection of 462,800, does this only cover the portals or even the new developments like the Fairview that we are extending 100 feet?
That's a very good question. I actually don't know the answer to that, but I'll be happy to look into that for you. But what I know, street department was budgeted for, I want to say, 3 people, and right now there are only 2 people that are allocated to that department. And I'm sure there's other things in there that I'm not aware of, but I'll be happy to look into that and let you know what it is.
Okay.
I'm unsure, I'm sorry. I don't
All right.
know the answer to that.
Thank you. Thank you.
May I move on?
Yes, sure.
So property tax, okay, I just want you to see how this goes. I mean, people always say, oh, you know, you get your property tax October, it peaks in February and it goes all the way down. I just want to let you see how this actually plays out in Keene. The top line is actually 3.228 million, which is the target for the whole year. And this is just where we are at $3,050,000, $130.48. It's just where we are right now, but I'm confident that we will actually reach our property tax revenue at the end of the year. This is just to show you what it looks like. And this one, I did a slide for the EDCA and B, which I didn't have time to put in this packet. This is just, I just want you to see how the sales tax revenue are moving from October to June. Remember, we have 2 new retailers, one that came in January, if I'm not mistaken. That blue line, the light blue line where it says month, if you follow that line, you see a huge jump between January and February, and that's just extra people coming in. And the other one that came on later on in June is Tractor Supply, because this is sales tax. They do the business in June, they report it in July, we will have it in August. So we should see this going up by the end of the year as well. And just to mention, year on year, I don't have it here, but year on year, we have actually grown by 12% in our sales tax revenue. So we have this cool software called sales tax, and I actually love monitoring, you know, who comes in, who's the newcomer, and how they move up and down, you know, from the top 10, and we are able to monitor closely. And with Mr. Martin, we actually work together closely, and we say, hey, this person is over here in Keene, where are they paying sales tax? So we've been doing that recently with this new sales, software. So it's been, I think it's better to monitor, you know, who are paying tax, who should be paying tax, and who are not, who are pending, and all that good stuff. This is what I really want to talk about. This is the 286 homes applications that we have in the pipeline. As you can see, this is how much is moved from 2020. And 2025 is almost 400,000. And this is just the great work of our city manager and our development services director. So I just want to say thank you both for all your good work. It's all done. Okay, well, there you go. There you go. Anyway, I think that might be, pool cash. Okay, as of June 30, there is $3,104,499.19. The reflected interest rate at the moment is at 3.87%. Then the successful negotiation and the great support from Pinnacle Bank will be reflected in the month of July. You will see the 4%. That's what I'm saying. They were Kerry Warwick and Jonathan Seitz and our friends at the Pinnacle Bank. Their great support of the city. We will see like a jump in the interest rate in the month of July, and I will be able to show you how much interest. This is for pool cash, and this is the reserve that everybody talks about, so I thought I'd just show it. We have just over $2 million in the bank for the reserve. It's earning the same interest amount, and with the 4%, it will go across all our money market accounts, and it's secure for 12 months, correct, John? Yeah. I think that is it. Okay, that's my last slide. Any questions?
So this is just a general question.
Yes.
I know you talked about the property taxes.
Yes.
The projection at the end of the year.
Yes, sir.
I know this November we'll be having some propositions on the ballot of trying to increase the tax exemptions for especially the seniors who are living within the city limits, generally in Texas. And the chances of it passing is almost maybe 80% because people have been kind of keeping an eye on it. So with that in mind, with your projection, so we have the veterans, we know sometimes they have an option with the property taxes. We have disabled. Of course, a few years ago, we passed tax freeze for seniors in Keene, and also we're having seniors. So have you taken in your model projection and tried to find out the impact that these three propositions are going to be on the ballot this November, if they pass, how they're going to impact the current projections that we have and next year, and then we have also the new homes. We might expect people to move in that are going to pay property tax, and then if we have seniors, we have disabled and veterans, we might find out that there's a limit we can collect from those homes.
Yes, sir.
So I don't know if that's a possibility to model that so that at least as much as we are trying to project 100%, hoping everything will be fine, to know if that doesn't work, where are we looking at? What are we looking at?
Thank you for that. That's actually an excellent question. So literally the way we project property tax is taking into consideration every frozen tax revenue that we will have for the future. So when we receive our tax roll on the 25th of July, it also includes the frozen tax revenue. If you give me a minute, I'll get my information.
Okay.
So to make it to the tax roll, which is what we do our projection with, the people, the protest, the application, what you want to call it, I'm sorry, has to be received, and all the homes need to be there by January 1st. I just had the privilege to speak with Scott Potter, Johnson County Assessor, tax person, actually 3 days ago. And he was kind enough to help me. See, that was a providential meeting because I didn't know that you were going to ask, but we went through the tax rate calculation sheet. So in order for us to project property tax, we have to use their certified values of how many homes that will be taxable for the year 2025, 2026. So it's not something that I can just say, oh, let's just do this, you know, and within this, if I can just read it to you, they give you a total market value, and they'll give you frozen City of Keene taxes, and they will say taxable value after the exemptions, which is, you know, the frozen tax, whatever, and it will give you, also take into consideration estimated protest value. So everything that you just expressed, yes, sir, it has been taken into consideration. And this year, for the over 65, there are 432 that we are taking into considerations of the value of 118,323, with a total value of 6,204,250. 250. And the disabled local, there's over 217,000. Disabled veteran, there's 84,500. And disabled vet, at HS, I'm sorry, I don't know what HS is, but it's over 1.2 million. So yes, to answer your question, these things have been taken into consideration.
All right, thank you.
Yes, sir.
Thank you.
And I'd like to add to that. So I did, at the last meeting, I'm glad this actually got brought up. I know you're referring to some exemption, the exemption, correct? That was part of your question, was asking about the exemption?
Yeah, there are some propositions that are supposed to be on the
Yes.
ballot this November.
So I did do some more research after that last meeting that I'd spoke and said, hey, are we thinking about the tax exemption? And I did find out that those tax exemptions only apply to our school taxes. So it has no bearing on property tax. So I just wanted to, for the record, say that I was misinformed, or I didn't do enough research, so that's on me, and I apologize for that. But after learning that, and I'm glad you brought that up, so that way, one, as a council, we all know that anytime that there's a mention of tax exemption, it has nothing to do with our property taxes. It has everything to do with the school taxes that we pay. That's why they're giving more money back to the 65 and older, the disabled, the veterans, because they have exemptions already in place for those things, or they're capped for a reason. So that's why Texas is giving back more money to those folks, because at that time you shouldn't have kids in school, right? So there's a benefit to them for those kinds of things. So not everybody, but it happens. So anyway, I just wanted to clear the air on that.
You're welcome.
Thank you.
Yes.
So with that item completed, we are going to move to item number 5. That's public hearing items. There's no public hearing scheduled for this meeting date, so we are going to move to item number 6. That's consent agenda. And there's a verbiage here. All items listed below have been previously discussed, required to deliberation or are routine by the City Council, and will be enacted with one motion. There will be no separate discussion of the items to be withdrawn from the consent agenda for separate discussion by the City Council. If discussion is desired, the item will be removed from the consent agenda and considered separately. Otherwise, approval of the consent agenda authorizes the city manager to implement each item according with the staff's recommendation. So we have 3 items here, item A, item B, item C, and there is some kind of notes here, but I'd like to ask if there is a council member that wants to remove some items for
Yes,
discussion.
I'd like to pull item A.
Item A. So item A has been pulled from the consent agenda by Councilman Rob Foster.
And I make a motion to approve the other 2.
Second, that's what I was gonna ask. If we could do that. Like, can we just do the others?
Okay, so a motion has been made by Councilman Rob Foster and seconded by Councilman, we have Ms. Smith, and I would like to call for any discussion first before I call for a vote. If there's no discussion, I'd like to call for a vote. Those who are in favor? Any against? Motion carries. Thank you. So we'd like to move to item A for discussion.
Yes, the only, just wanted to point out one little minor discrepancy. I was present at that meeting, but my name isn't mentioned as members present. And just if that, with that correction, I'd like to move that we approve the minutes of August 7.
May I have a second?
I'll second.
So a motion has been made by Councilman Rofosa and seconded by by Councilman Shaw, and I would like to call for any discussion. If there's no discussion, I would like to call for a vote. Those who are for or who are in favor? Anybody against? The motion carries unanimously. Thank you. You're saying?
You didn't ask if you could.
I wasn't here, so I didn't vote on it. That's abstaining from the vote.
Okay, so you like to abstain. So Councilman, we have Councilman Chucky Isley is abstaining because he wasn't present in the previous meeting. Thank you. So just for the record. So we'd like to move to item number 7. That's a general business item for discussion. And item A, review, discuss, and consider healthcare benefit for the city employees from United Healthcare and Texas Health Benefits Pool for fiscal year 2025-2026.
Good evening, Council. Mr. Rodney Dryden is here this evening. He and his team are professionals, and they bring an abundance of information to the insurance industry. I've known Rodney for some time. I consider he and his team as a friend as well. He has provided some medical providers, and he's going to go into details. Of course, I briefly kind of touched on that the last time that I spoke, and it was referenced United Healthcare with Merck. And we also have Texas Health Benefits Pool and the Curative Health Plan. Curative Health Plan is kind of new to the industry, but I will allow Rodney to go into details with that. So, Rodney, if you want to come on up.
Sandra, thank you. Mayor, Pro Tem, Council, thank you for having me. As Sandra said, Rodney Dryden, Hub International. Thank you for the opportunity to work with the city of Keene. We do represent quite a few cities throughout Texas, roughly 200 or so, about 600 or so political subdivisions, so we do understand the political subdivision world. As you know, your program now is with United Healthcare. The initial renewal from United Healthcare, I know is surprising. They asked for a 9-some-odd% increase. We immediately got them down to a 0 increase. So we're in a really good spot. Our worst case scenario is we do nothing and our costs don't change. Our best case scenario is we move to Texas Health Benefit Pool, which many of you know is TML, for an approximate reduction of approximately 13% compared to our current cost, and they matched benefits, which equates to about $100,000 savings in total cost. So we also looked at all of your programs, your dental, life, vision, disability, your ambulance service, teledoc, all of those things. So I'm going to run through all those things pretty quickly. But in your in the slide presentation, Sandra, thank you for putting this together. These are our medical options. We have United Health, as we discussed. We have United Health with what is called a MERP, which is under Section 105 of the Internal Revenue Code as an option. Then we have the pool, and then we have curative. So this is our United Healthcare. We started at a 9.9. After negotiation, we got them down to 0%. United Healthcare with the MERP, what is this? We basically increase our United, we stay with United for our healthcare provider, but we increase our deductible from 1,500 to 6,750, and you overlap that with what is called a MERP, Medical Expense Reimbursement Plan. What does that do? Under Section 105, you put a MERP on top, so instead of having a $1,500 or a $6,000 deductible, your employees have no expenses out of their pocket. The MERP covers 100% of employee out-of-pocket. So that program, when you pair those two together, represents a 5.4% increase in cost. So that was one of the options that we looked at. This is the Texas Health Benefits Pool. So Texas Health Benefits Pool, or TML, as many of you know the name, they have their own risk pool.
I'm sorry, sir. We got a lot of this information in our packet, but it all kind of ran together for me.
It's a lot.
Would you mind sliding back? I know you
bet.
said 5.4% increase, but what is that in a dollars amount?
In dollars, 5.4%
Is that the 47?
To the city, 47,251.
Okay, thank you, sir.
Sorry, we've looked at these numbers a lot of times, so, and I didn't spend a lot of time on this, I apologize, because it didn't seem to be the best option.
Okay, thank you.
You're welcome. So, Texas Health Benefits Pool. What we got from them was we asked them to match the benefits that you currently have. You have two programs now that your employees can choose from, a traditional copay PPO plan and a high deductible health plan with HSA as an option. So we asked them to match. On the on the copay PPO plan, they're 13.5% less than what you're paying currently. On the high deductible health plan, or HSA as many of us call it, they're just slightly less than current, 0.62. When you blend all that, it's an 11.9 reduction, or $103,000 total cost reduction compared to today's expenses, not the renewal, but today's expenses. So, and that's also based on your current population of covered employees. So, Texas Health Benefit Pool, as many of you may know, they utilize Blue Cross Blue Shield's PPO network. So I know that the city offered Blue Cross Blue Shield last fiscal year to employees. So it is the Blue Cross Blue Shield PPO. The Blue Cross Blue Shield PPO just went through contract negotiations with THR, UT Southwestern, or Texas Health, that I think many of you know of. So they've just re-upped for another 3 years, so that network is strong for the next 3 years. We don't have that concern. $1,500 on the copay plan and $3,500 on the high deductible health plan, HSA. Yes, sir. The copays on that, and we skinnied this up quite a bit because otherwise it would have been a massive amount to look at. The Texas Health Benefits, the office copay are $30 for general practice, $60 for specialist. And then the plan pays 80% after your $1,500 calendar year deductible. And then the prescription drug copays vary from $0 up to $175. So I'm glad that you pointed that out. The prescription drug copays currently are $1,545 and $85. So there is the potential with Texas Health that your employees could have higher RX copays at the point of service at a pharmacy. Just depends on the drug they take. So, but the savings is substantial with TML. Their pool is averaging, or at least in 2025, their pool is averaging about a 7% increase year over year in cost. That's the average. We have some clients with them that experience less than that and some that experience greater than that. So if we do choose to go there, TML, or Texas Health Benefits Pool, utilizes Navitus as their prescription drug program. That's probably the largest complaint we get from our clients about Texas Health Benefits is their prescription drug program, just transitioning from one carrier to another. That's probably our single largest complaint that we get. Followed by routine, well, not routine, but testing such as MRI, CT scans, getting approvals quickly. So just want to be aware, I've been transparent with Sandra about that. Those have been the two biggest sticking points. Any other questions that you would like to ask on TXHB? Curative. This is a new program in the marketplace. How new? 3 years old. Curative, the gentleman that started Curative started it because of COVID. He, at age 26, decided he wanted to start an insurance company, and he did. He was into COVID labs and testing stations. It's quite a story. In 3 years' time, he's created an insurance company called Curative. It's A- rated with AM Best. You do not get that financial rating unless you are strong financially. They've grown in that time to upwards of 150,000 members. To give you perspective, Texas Health Benefit Pool has been around for 45 years. They have 42,000 members. So in 3 years, Curative is almost 4 times the size of Texas Health Benefit Pool.
Are they nationwide?
It's a nationwide PPO. Contract side of states are Texas, Florida, Georgia. They're starting to move up the eastern seaboard, but currently it's Texas, Florida, and Georgia for Citus, but you can have employees anywhere because they utilize Aetna's First Health Network as one of their network options. We've, in fact, effective October 1 of this year, we're moving 5 more cities to Curative from United Healthcare, from Blue Cross, from Cigna. It's just something new. So I just want to tell you, why are you talking to me about an insurance company that's been around 3 years? It's taken off because it's changing. It is literally bending the curve on expenses. They're huge on prevention. Employees are strongly incentivized to make what is called a baseline intake call. The risk has already been done. We know what the rates are. They're on the screen. An employee completes that intake call, Curative waives the deductible and the out-of-pocket. The only thing that your employee may have an expense for are 2 potential prescription drug copays, either $50 or $250. If you have if you need an MRI and you've done your intake call, it costs $0. If you need to have a baby and you did your intake call, it's $0. So they're serious about this. We have a lot of clients with them, and the feedback has been honestly phenomenal. So what they did is they quoted a triple option program. We showed all 3 of them just so you could see what happens if all employees took each plan. So Curative has also offered a $25,000 upfront transition credit that they would credit in month 2. If we did the EPO, you can see by cost, we have PPO in the left column, EPO in the center column, and what is called PPO max in the far right column. The EPO is it is First Health Network with no out-of-network benefits. We looked at your network utilization with United Healthcare. Your employees are using just over 99% of all procedures are done in network now. And that disruption with First Health worked out almost the same. So I'm not concerned about that. I just did a big disruption report for a city that's about 3 times your size. We looked at about 5,000 claims because they're going to Curative, and all but 4 claims were processed as in-network. Yes, sir.
So who do we have providing our service now?
United Healthcare.
United. So if we switch to Aetna, then the providers may be out of the network that's United Healthcare's.
In Dallas-Fort Worth, United Healthcare, Blue Cross, Aetna, Cigna, their networks are very comparable. So I don't have a concern about network access. Texas Health Resources, Baylor, Methodist, UT Southwestern, Cook Children, all of those are contracted providers with the First Health Network through Curative. And they're also in Blue Cross's network through Texas Health Benefit Pool. So network-wise, I'm not concerned about coverage. One of your neighboring cities actually just went to Curative. So they just went through this same process.
Didn't we have Aetna before? Does anybody,
You had Blue Cross Blue Shield in the prior fiscal year,
okay, and now we're United Healthcare?
and now we're with United. So my job as your broker is to make sure we're covering the waterfront and we're bringing options in that make sense. And to try to drive costs, keep costs flat. I don't know if you've talked to any of your peers or even at your own employment, to have options here at the city where costs are going down and we're not giving up benefits, it's a pretty substantial win for us, so I'm real pleased with that. So Curative is if we do the EPO as our base plan, meaning the city bases its contribution on the EPO, the city saves $61,000 plus gets a $25,000 transition credit. So our cost basis goes down 7% compared to our cost basis going down 11% with Texas Health Benefits, okay?
Just so you know, I did ask, one of the questions that Captain Stroud raised was, how many people is this gonna interrupt PCP, primary care physicians, those types of things? And I think the report I got back, there was maybe 2 employees that it could possibly affect, was that right? Yeah, it was like 2 employees. So in other words, almost all of our employees would be able to keep the people they've been using. And I don't know which 2 those are, but.
And I'll tell you something that's extremely unique about Curative. If your doctor is not contracted with First Health, you can nominate that doctor. Curative approves that doctor. They give you a cash card. Every employee here gets a MasterCard, and you can use that up to $25,000 on that MasterCard for health benefits. They want you to maintain those relationships. It's really bending in the curve in healthcare and changing things dramatically. It's a whole new approach to healthcare. So it's weird. So, but it's been very well received. I counted last week, and I've had a lot of numbers shoot through my brain, but in Texas, we have 29 political subdivisions that have moved to Curative in the last 18 months. And the feedback has been extraordinarily positive. So it's healthcare, it's not perfect, but it's something different. And where they are really outperforming, in my view, all of their competition is the member experience. Your employee takes the time to do the intake call where they can share as much or as little about themselves and their health conditions as they choose. It is not required, not a requirement to tell about your health conditions, but if you choose to, you can. And when you do that, they waive the deductible and they waive the out-of-pocket. That's huge. What we've seen in healthcare is that many people need to have an MRI, they need to have a CT scan, and they don't have $1,500. So they put it off, and they put it off, and they put it off. And then something breaks, and it costs a lot more 5 years from now than if you'd have gotten it fixed today. So that's Curative's model. Let's get it fixed now, remove the barrier to care so that people can get the treatments they need now. It's a great program. I'm not pushing it any harder than the others, but cost-wise, it's a reduction, not as big as Texas Health Benefit, but to the member, to the employee and their family members, it's a tremendous option. Each person age 18 or older is strongly encouraged to make that phone call. If they do not, they have a $5,000 deductible. So the carrot is do the call, we'll waive the deductible. If you don't do the call, you have a $5,000 deductible. It's an annual call. If you have children over age 18, they too are required to make the call. It's an almost 99% completion rate for the call across the curative enterprise. And they investigated that to find out why 1.7% of the people were not making the call. Many of them were about to change jobs, or they were not teenagers, but college-age kids that just refused to do the call. You get 120 days to make the phone call. During that 120-day period, they waive the deductibles. So during the first year, you get 120 days to make the call. So, and there is no grace. Day 121, it is over. If you didn't make the call, you have a $5,000 deductible. That's how it works. Any questions on that?
Oh, sorry.
Right.
No, go right ahead.
So my question, and I'm going to try to spin it in a different way because in the past, I've talked to numerous people in my life who have complained about healthcare. And I know you just mentioned it's not perfect, and I understand that. But here we have 50 some odd employees who are used to the way things are now, right? And so what I'd like to ask you is, given the proposed things that you have given us, which one is going to seamlessly work for the employees and keep it regular? And I'm asking this because I'm at some point you have to think about the employees' morale going through a change. And so if they're being asked to go from one provider to another, how much of a pain in the neck is it going to be to do that crossover? I know you're mentioning this phone call that has to happen or is strongly suggested, let's put it that way. You know, but aside from the phone call, I mean, is it as about as seamless as a transition as you can possibly get? And so is it a seamless process? And then which plan of the three here that you're pining for pretty hard, if I can say it like that nicely, which one would you choose if it was you sitting in our employees' chairs?
First, I'll tackle the last comment. I'm not pining for curative. Curative is a new option in the market, and because it's so different, I spent a little extra time on it because I think it's important that you understand what separates them or what differentiates them from what we have all come to know as healthcare. So the reality from my perspective is this: we are not renewing with United Healthcare because we're sitting at a no increase with United, which is fantastic, but we are likely changing from our current United Healthcare program to either Texas Health Benefits or possibly Curative. We are going to experience disruption to your employees regardless of the change. And frankly, Curative would be less disruptive in that environment. Here's why. You do the intake call, you don't have to worry about transitioning your deductible from United Healthcare to Curative.
Right, because it goes away.
Right.
Yeah.
And when we move from United Healthcare to Texas Health Benefit Pool, we'll have to get a data file sometime in October, transition that over to Texas Health Benefit Pool, get them to load it hopefully correctly and applied to the correct people, so that if somebody had a medical procedure in the last 90 days of 2025, they get proper credit for deductible and out of pocket. So we have people who are taking prescription drugs now that might have required prior authorization or step therapy. So regardless of the change we make, there could be disruption in that. You asked from my experience. I have exactly 1 year's worth of experience transitioning clients from traditional companies to Curative. They have gone more smoothly than transitioning from United to Cigna, Aetna, TML, Blue Cross, doesn't matter. It's gone more smoothly in that transition. My role for this, in representing the city of Keene, is to bring these options, make sure staff and council understands them, and hopefully every year we can come in without talking about giant increases. We're in a great spot this year. We have two options that save us money. And this option not only saves the city money, but it could save your employees money out of their pockets. But the Texas Health Benefit option, to your point, It's what people know. They're accustomed to a deductible, they're accustomed to a copay, and it saves $103,000. So, recommendation-wise, would I make a direct recommendation one over the other? The fiscal person in me, looking at dollars and cents, tells me Texas Health Benefits Pool because we can save $103,000. From the member perspective, if you think of what I try to do, I try to put myself in the position of that public works person who can't afford a $1,500 deductible. There's an opportunity for that to go away. So I try to look at the global piece of this. I will stand here before you tonight and tell you, we will have problems with any one of these insurance companies we're talking about because it's insurance. But I can tell you our resolution rate is faster with United Healthcare and Curative than it is with Texas Health Benefits.
Then I had a follow-up question. So I know you mentioned in the last, on the TXHP, yes, there's a savings of 103,000, but I believe you mentioned that in the EPO, if we chose that plan, which we would choose one of the PPO, the EPO, or the PPO max, correct?
We
So there-
have all three, but my suggestion is if Curative is the answer for the city, that the city bases its cost for contribution off of the EPO.
Okay, so that's what I was getting ready to ask. So on that one, there's a savings of 61,000 plus the 25,000 that's not built into that, correct? So it would actually be 86,000. So we're talking between,
$17,000.
yeah, between the two, we're talking very minimal. So, okay, that was my last question. Thank you, sir.
No, you're exactly right. Yes, sir.
So my question is, would you mind refreshing my memory, the difference between the PPO, EPO, and EPO max?
Absolutely.
It's from the benefit standpoint.
From a benefit standpoint. EPO, PPO, PPO max. I'll do the easy part first. On a PPO, you have an in-network benefit, right? And you have an out-of-network benefit. With an EPO, imagine those two columns, and you rip the right-hand column off, which is out-of-network with the EPO, and you no longer have out-of-network benefits. So, but you don't have to select a primary care doctor, you don't have to have referrals, so it's not an HMO in any way. It's a PPO, exclusive provider organization. The hospitals, doctors, labs, all of those things for all three of those plans are the same. The EPO has in-network only, unless it's an emergency. The PPO and the PPO max have out-of-network benefits. The EPO and the PPO do not have CVS or Walgreens. They do have HEB, they have Costco, they have Walmarts, they have a lot of mom and pop pharmacies, those kinds of things. Do you know why they don't have CVS or Walgreens? The two most expensive places to get your prescriptions filled. Blue Cross owns 40% of Walgreens, CVS Pharmacy owns Aetna.
Not the other way around?
I'm sorry? No, it's actually CVS Pharmacy owns Aetna Healthcare.
Something wrong with that picture. Yeah.
If y'all are pretty sharp, I can tell, the money's in pharmaceuticals.
Yeah.
So, United Healthcare owns Optum Rx, which is where you get your pharmacy now for your employees. So, United Healthcare is the 8th most valuable company in the United States. So, with that, we have great options, and sometimes when you have great options, it makes it more difficult. If we were standing here with, this is horrible, we're faced with 25%, what do we do? We're faced with 25%, we have to do something. Do we save 7%? Do we save 11%? Do we let the city take all that savings, or do we share it with the people through Curative?
So you mentioned some drugs are $250, some drugs are $50.
Yes.
The $250 drugs, I'm hoping, are IVs.
The $250 drugs are your extremely expensive injectables, your Skyrizi's, your MS drugs for like multiple sclerosis that cost about $120,000 a year, Humira that's $80,000 a year, those types of drugs. But your diabetes medication, your high blood pressure medications, your cholesterol medications, those are $0. I can tell you if there's anyone here that's a migraine sufferer, all those migraine meds are $0. Most of your insulin are $0. Of course, any prevention, birth control, all those types of things are $0 also. Their website is super easy to use. I directed Sandra to it. The drug cost in the clients that I've presented to and the clients that have contracted with Curative, those copays have really not even come into a conversation point. Your copays now, if we move to Texas Health Benefits, your copays are going to be
30 to 60, you said?
yes, well, that's your office copays.
Oh, that's office costs. Excuse
But
me.
your pharmacy copays are gonna be 0, 10, 45, 90, 150, or 175. So compared to what you are now, which is 15, 45, or 85. So it's a trade-off. You know, my situation is different than the next person's.
Sure.
So we have great options. So kind of, you know, if we want to tackle a couple of easier things while y'all are simmering.
I just want to make sure I'm understanding here too. The $25,000 transition credit, does that go to the city too, or?
Straight to the city.
Okay, so it's really like Troy was saying, the 61,000 plus 25,000.
There's a $17,000 delta between Texas Health Benefit Pool.
Oh, the delta. Okay, I missed the delta part. Thank you.
Okay, you bet.
So just kind of, everybody would get approximately a $500 HSA card then, is what you're saying?
No. Everybody gets that card can be used for multiple things. Let's say that they call it a cash card. If your doctor is not in Aetna's First Health Network, and you contact Curative through their website and say, I'd like to nominate Dr. Smith, there's a nomination process. It takes about a week. Once that doctor's nominated, you can use your cash card for that doctor, whether they're in Aetna's network or not. You can spend up to $25,000, but you can spend $500 a day at a physician's office. And if you go to their website and you go to provider search and you look up Dr. Smith may already be a cash card appointed doctor. So I'll give you another real example. Cook Children's Hospital in Fort Worth, they just got into contract dispute with Curative, or through their direct contracting. And Curative said, we are not paying you the increase in reimbursement that you want. And so they got into an argument about it, and Curative said, you're a 501c3, you have to accept cash payment as payment in full, we're paying you cash. So if a person goes into the doctor at Cook Children, they present that credit card and their ID card, and they have to accept the reimbursement as payment in full. They can't come after the employee because they're a not-for-profit. So whereas Blue Cross, United, Cigna, Aetna, all the big ones, all the big networks, they pay those increased fees. Curative said, nope, you're not-for-profit, we're paying you cash. And it's
How do we get that?
I'm sorry? So, I mean, they're very innovative, I'll give them that. So we have United Healthcare where we could renew, no increase, no change in benefits. Texas Health Benefits lined up benefits very nicely. Prescription copays are a little higher. At an 11% reduction, $103,000. Or we have Curative, where we could offer the EPO as the city's base. If an employee said, you know what, I want the out-of-network benefit, that makes me feel comfortable, they could pay extra out of their check and have it. If they wanted the PPO Max because they want CVS, Walgreens, they want boutique gym memberships through ClassPass, they want a nutritionist to walk around HEB with them and help them select a meal plan, they could go to PPO Max. And they get to pay the difference out of their pocket or out of their paycheck. My focus, benefit for the employees and budget for the city. Those are my focus. 61,000 reduction compared to current in real cost, not monopoly money, plus a $25,000 credit.
So, since we have some city employees here who would be affected directly by this decision, does anybody want to raise your hand and chime in on this? Because I'm thinking curative probably is the way I would vote if it was me.
Does the curative also do like the mail order prescriptions?
Yes, but if we're to believe their data, 96% of all their prescriptions are covered at $0.
Okay, because I know I take one that I have to order and,
You get 90 days for
yeah.
a copay, or 2 copays or something.
You need to leave me a card. I need to turn you on to Southwest. Our insurance company over there right now is awful.
Do you mean Southwest Airlines?
No, Southwest Dodge.
I was about to say Southwest Airlines, that is a client.
No, not quite that.
Okay.
Need to find a way.
So curative is not just public sector, they do private sector. So, but we have great options. And I know, Jonathan, we talked a lot about Texas Health Benefits and the savings. So what I don't want, and Councilman Smith, I'm not saying this to be any sort of way, but it is not my position to maneuver you into one thing or another. It's my job to present the facts as we have them so that you all can make informed decisions. So I'm here to support the city and what its desires are for their benefits and for their employees. So those are our healthcare options. We have dental currently with United Healthcare. My recommendation is that we move it to Mutual of Omaha and reduce our costs by 10% and for same benefits. So those are costs that the city pays and employees pay. Yes, sir.
Okay, you're in my wheelhouse now. So do you have a list of dentists who are in Mutual of Omaha's?
Yes.
And what, did you happen to poll the employees on that list as well?
We do a geo access to see how many dentists are available within a 10-mile radius of each zip code that's provided on the census. And we had a 2 in 10 match on everybody that works here and their dependents. So at least 2 dentists in 10 miles. Mutual of Omaha actually has a larger dental network than United Healthcare. We have a lot of clients with Mutual of Omaha dentists, dental coverage, and they're happy. Are you a dentist by chance?
No, but I'm a dental sales guy.
Okay. So.
I just don't see Mutual of Omaha ever listed on their.
Really?
Yeah, no, never have.
What I
Are
like
they
about the Mutual of Omaha plan
Are
is
they an umbrella company,
it's Mutual of Omaha.
standalone?
They don't do healthcare, well, anymore, they used to do healthcare, but they have higher reimbursement schedules for non-contracted dental providers, so you have a dental network.
Right.
But we have a PPO dental plan, so you can go any dentist you want to go to. But if you go to a contracted dental provider, they reimburse at the 90th percentile of reasonable, and customary.
UCR, yeah,
UCR, I'll get it out in a minute. So dental insurance, when you lump in the top providers, MetLife, Guardian, Mutual of Omaha, Principal, it's almost commoditized.
It is.
So you get into that scenario. So in my view, you're going from a B+ company to an A+ company on the dental coverage for your people, and it's cheaper. Vision, same thing. We can save a few bucks on a plan that is similar, or we could go It's my opinion, you have a $130 allowance with your current United Healthcare Vision program. The matching Mutual of Omaha Vision Plan has a 130 allowance. Ignore the 23%. Yes, that's the savings as a percent, but it's a shock value number. It's really $300. My recommendation actually is plan option number 2, where we increase the employee's benefit from $130 to $200, and we pay the same money we're paying today for glasses. And it would be a 12-12-12, so you could get your glasses, contacts, and exam once a year versus every 2 years for frames.
It's a better deal, too.
So, you know, it is what it is. So I think Mutual of Omaha Vision, $200 max, to me, no, we don't reduce our cost, but we enhance our benefit dramatically for the same money as we're paying right now.
Better?
Sir, I have a question. Is it to my understanding that between the current dental plan and Mutual Omaha, the only thing that is, well, it's not the only thing, but one thing that is missing is orthodontics for adults?
It's covered.
It's covered?
Mhm.
Okay.
Yep. They matched your current plan.
Okay. Oh, it just.
I see it says child,
Yeah.
child only. They matched your current benefit.
Okay. Thank you.
You're welcome. So this is our basic life program. You currently have that with United Healthcare. You provide $50,000 worth of coverage to the employees that is paid for by the city. This is absolutely a commodity. We can save $1,000 a year by moving it to Mutual of Omaha. Sorry, there's a lot to look at on this page, and we trimmed it down. Your current United Healthcare long-term disability that is paid for by the city is $14,000 a year. Mutual of Omaha, actually better coverage, includes an EAP with 3 face-to-face visits. Travel assistance is $10,181, so we're actually going to save about $3,600 a year and improve the benefits for your employees. Down at the bottom of the page, short-term disability. Our recommendation, currently the short-term disability is voluntary. Voluntary means your employees pay for it. We're suggesting with the savings that you're recognizing on dental and life and long-term disability, that the city fund the short-term disability. The cost is $10,849. We're saving a little more than half of that just on dental savings, life savings, and long-term disability savings. And then the next agenda item, I'll explain how we're going to be saving more money. But our recommendation is that the city fund at short-term and long-term disability for employees at a cost of the new benefit, net cost of about $5,000 annually. Medical transport, currently you have CareFlight. So everyone familiar with CareFlight? So if you need to take an ambulance ride, whether it be ground ambulance or air ambulance, and you're fortunate enough that CareFlight's the one to pick you up, you have a benefit. But if Allegiance, PHI, MedStar, any of the others come for you, you have no benefit. We recommend MASA because they cover any service. It doesn't matter. Your insurance company pays what they pay. They cover the rest up to $20,000 for air ambulance. They pay for hospital to hospital, ground ambulance, air ambulance, up to $20,000 per trip, per covered person on the air ambulance. The cost of this program for the employee, if the city pays it, is $7 per employee per month. So that's $84 a year. Average air ambulance cost in Dallas-Fort Worth is about $34,000 for a one-way trip. Your healthcare company's going to pay about $14,000. You're going to be stuck with the $20,000. This would cover it. So it's a tremendous benefit to offer. We can offer it if the city pays for it at the $7 or $84 a year, and your employees want to cover their family members, their spouse, their kids, whatever, it's $10 extra for them to pay out of their paycheck for that benefit. And Massa, just so you know, they've been around for almost 50 years. They represent about, I think it's about 500 school districts in Texas, about 40 counties, and I can't remember how many hundred cities. So, I mean, they're well-known. And again, it covers any service, any ambulance, emergency and non-emergency. Any questions for me? Done a lot of talking.
Is that Massa anywhere? Like,
North
only in Texas, or is it all of the United States?
Yeah, so you could be in Canada. They have some plans to actually offer worldwide coverage. But yeah, if you're in Wyoming, Colorado, you have a situation, the plan we're recommending at $7 is their emergent plan, so it's just their basic plan. They have a premier plan that covers more, and then they have a platinum plan that covers even more than that. But the middle of the road plan is $10 per employee per month.
Can't we buy this by ourselves? Isn't this something that's
You
open?
can, but it's expensive.
Is it?
It's like $5,000 a year.
Okay.
Yeah, to me, it's not worth it. If you can get your employer to do this, it's way more affordable. So, it's a tremendous benefit. I would say, in fact, I have a couple of cities that are contemplating offering it to their citizens, so we're working on that with Massa right now. So what we're trying to do is we're trying to incorporate, because we have a lot of large clients, we're trying to incorporate that large client pricing model in so cities can put it. I have a couple of cities now that put it on their water bills. So it's an opt-in, opt-out program.
That cut out our ambulance service then, getting paid? Would that cut out our local ambulance service getting paid then?
No. No, because your healthcare is gonna pay them what they pay. If it's over and above what the insurance company pays your local service, Massa picks up the difference, so the
Oh.
employee, or the
It's a
citizen
gap
doesn't have to-
type in? Okay.
One thing we didn't mention that I think Sandra mentioned in, I think you said the prior meeting, was the new benefits, the teledoc service. Do you want me to talk about that or no? So we have a program called New Benefits. It's a teledoc service that we're recommending. It gives all your employees access to 24/7 teledoc, whether they cover their dependents or not. It's a teledoc service for dependents also. The thing I like about this program, United Healthcare has that feature now, but it counts as a claim against our plan. With this freestanding service, it doesn't count as a claim against our health plan, so it saves us expenses, and it works really well. And it's also available to, as generous as the city is, you may still have employees that do not cover dependents. So it covers anyone in the household. And it's $850 a month per employee. And that, sorry, that was not in the packet, and Sandra, I think I dropped the ball on that. I covered a lot, and I apologize for that, but I'm here if you have questions. This is for an October 1 start date. So we do need to act, so that y'all don't hate insurance more than you already do.
So I have a question.
Yes, sir.
Let's go ahead.
No, I just wanted, you kind of asked if any employees had any input. So I have a little.
Please.
Well, I've been with the city almost 15 years now, and almost every year it's been either Blue Cross or United Healthcare, back and forth, back and forth, back and forth. So there's always been a change. So that kind of answers one of your questions. So no matter what we do, we're kind of used to that, and sometimes it goes smooth, sometimes it does not. The other thing is, I'm older, I'm single, I don't have dependents anymore. I hate going to the doctor. I'm active, I'm healthy. I do get injured, though, playing sports. So last year, I didn't go to the doctor at all, other than a couple of visits for some blood thinners I take. And so when I got ill with a stomach virus, I hadn't met any type of deductibles or anything, but I needed a CAT scan to figure out why I was losing all that weight and what was wrong. And so, yeah, that was tough on me to come up with all that money. I had to pay it all myself, basically, because I hadn't met my copay for the year. So, just something to think about.
So our monthly HR networking, I have repeatedly asked throughout the year, and there are several HRs with other cities that have asked repeatedly, where's the downfall? Where's the hiccup? I mean, it sounds too good to be true with Curative. To this day, and I've been following Curative for 3 years, I have not heard one bad thing, period, at all, so.
So if any,
Microphone over here, but I'm still just want to clarify that one thing with that $25,000 crash cash card that seems too good to be true, quite honestly. So you're
What their
telling me,
marketing material says.
I'm sorry?
It's what their marketing material says.
Right, I'm sure it does, in bold letters. So say my Dr. Smith is not in network. It's a specialist, maybe we'll say dermatologist, just for argument's sake. Not in network. So but I got to go see him. I've been seeing him for the last 10 years. Then I flash my card at him. He takes that for his $100 office visit or whatever that is. And then I submit his name to be approved. What if he's not approved?
I would submit his name first. The guidance is to recommend that doctor for nomination first, and once approved, then use the cash card. And I can tell you a nuance of those 3 plans, PPO Max, they let you pay and we'll work out the details later. That's why they charge so much more premium for it. But in the EPO or the PPO, make your nomination. Once that doctor's approved, like I said, it's about a week, then you use your cash card and you just pay them cash anyway with the card.
I see. Okay, so in essence, as far as the employee is concerned, there is no out-of-network
And that's,
unless they exceed 25 grand.
it's just like now, if you used a non-contracted provider with United Healthcare, you're gonna have to satisfy your $5,000 deductible first. So it's almost like not having insurance anyway. You bet.
okay.
Absolutely.
So
Please.
one of my questions almost mirrors the question that you just had. And sometimes I've had doctors where you go to them and say, this is my insurance. And they will look at it and say, okay. And because of the previous experience, maybe bad experience with how they do normally billing and how they pay and all the back-end deals and negotiations. So some doctors just prefer not to take certain insurance. So in that case, you have employee, they have had a very good relationship with this doctor, and for many years, their family members know this doctor, but because of, doctors talk to each other, which insurance is hard to deal with, which insurance is good, and all that stuff. So if they say, if for example, Curative says, you know what, we like to take this person in, but these are the rules. And then they're like, okay, wait a minute, I don't want that. So what does the employee do? Do they have to switch to another doctor? How does that work?
Yes, so your employees are faced with that same thing today when they've changed from Blue Cross to United Healthcare. There's the potential that someone within the employee base at the city had to change doctors. Small chance, but still a chance. With Blue Cross or United or Cigna or Aetna, you're just out of luck. You just have to pay out of your pocket to see that doctor. That could still happen with Curative. The difference is you at least have the option to nominate that doctor, and then it's between Curative and that doctor to direct contract with one another. And Curative says to the doctor, accept our cash card and we will pay you cash at the point of service. Virtually all the doctors that I have heard that have been nominated have been approved, because the doctors are now receiving full cash payment at the point of service and not having to submit claims to the insurance company and then get payment sometime in the future. Because United Healthcare has 45 days to pay a claim. With the cash card, they get their money at the point of service.
Yes, so that's for convenience.
There's still the potential that a doctor says no. There is still that potential, absolutely.
Okay. So another thing is, I know you have mentioned these other insurance options, and you're saying at the moment we have 99% of our employees who are in network.
Correct.
So, which is a good thing. But now, this is just something that, a discussion that has been happening year after year when we have insurance discussion. Last year, the previous city manager did bring before us about where we are standing in terms of Johnson County. How do we compare with, when you compare us with other cities, big and small, of our size? And we found out that we are a little bit off. And he recommended for us, maybe this year, which might be a little bit difficult based on the discussion, that we try to adjust. He recommended baby step to reduce the dependent from 70%. Right now, I think it's 70% to 50%. And I know the employees, we have 100% at the moment. So if we do that, if we were to use that as an option, which I know you have to run some numbers, how does that affect the out-of-pocket for the employees and also the copay, and what will be the cost saving for or the financial impact for the city?
If I could interrupt for just a moment, if we're going to save the city $62,000 and give the employee better coverage, why in the world would we want to cut the dependents' coverage?
I'm not saying we need to cut the dependent coverage.
That's what you're asking. Take it from the 70
okay.
to 50%. That's cutting the coverage.
It was a recommendation from the previous budget season, and they said next year we might have maybe a discussion about it.
Okay, we're discussing it.
Yes, we are talking about it. But now I'm asking, if we were to go with 50% instead of 70%, what will be the impact in terms of the city financial impact?
Probably less than $25,000.
So that's and then you did mention about the $25,000 card. So that's going to be for each employee?
No, I want to be perfectly clear on that. Your employees do not get $25,000 on a card. The employees have the ability with that card, if they are having a procedure, they can have that card for what they call a single case authorization, like if they needed to have an outpatient surgery, up to $25,000 and use that card. There's an approval process, and it's usually within a day. So that's what it is. An employee can't go to the grocery store and swipe that card. So that card is for ICD-10 codes, ICD-9 codes that are medical codes, as you know. That's the only thing that chip will read. So that's how it works. So, but to answer your question about what your surrounding cities do, off the top of my head, I can't answer, but we represent most of them.
Okay.
So, and that varies. People always think the larger the city, the cheaper the benefits, so on and so forth. It's almost inverted from that. So smaller cities your size, for a city your size to pay 100% of the employee and greater than 50% of the dependent contribution is not unusual. So, but that's this city's decision to make. But I can tell you, we have the data. Because like I said, we represent virtually all the cities around you.
And then, you have a question? And then, so based on that recommendation, I know the city manager has been talking about this because he has talked to other cities around us, and he's saying we might look into adding more employees.
Okay.
I know the city is growing. So based on that, with the current rates that we have, I know we have approximately maybe 50, how many, 55 employees. And we are looking into maybe adding more. It's just a projection.
It won't matter until you add 100 more.
So that's the max is, oh, if you add 100 plus, then that changes the cost.
150 plus. So if you had 150 employees, Blue Cross lumps it together. 2 to 50 employees is one market segment, 51 to 150 is another market segment, over 150 is another market segment.
Okay.
And then, so if we grow from 55 to 65 employees, it's not going to really change anything materially except cost because we have more units to pay for. So what that also means is that next employee you hire, you don't know what that person brings with them to the table as far as health. So it's just the cards, we play with the cards we're dealt.
And we are blessed with a healthy staff, for sure, which is why this is why we're in the good situation we're in.
100%.
So just for the record, I know the Councilman Rofosa did ask that, do I want to reduce the insurance? And that's not the discussion right now because we are working on 70%.
Correct.
Base projection. And the issue was, last time was we had to look into, there are some employees who are, maybe if you get somebody that is in their 20s, 30s, 40s, the way they use insurance is different. We have dependents. Some might be single. They don't have people that depends on them. So that 70% doesn't make sense to them.
It's a benefit, not an entitlement.
Yes. So some will prefer to get paid more cash take-home than having to deal with these high deductibles and all that stuff. So that's where the discussion was, like, how do we take care of those employees who will want to
Sure.
be able to utilize, yes, insurance that we have, the options. At the same time, they might want to get paid more to match other cities so that they can have a more take-home.
So those are personnel matters that I don't typically get into, but I will tell you, insurance is just that. It's a benefit, not an entitlement. So you hire a 25-year-old today who's single. Well, 5 years from now, he may be married and he may have children, and he can take advantage of that 70% dependent contribution. I believe I heard this gentleman say that he's been here 15 years, and at one point, he took advantage of that benefit, and he no longer needs it. It's a benefit, and it's there for those who need it so that they may benefit from it. So, you know, the other discussion about what to do with contributions and so forth, we can look into that. I would even suggest that you do a total compensation statement for your employees, where it shows salary, benefits, certification pay for these gentlemen back in the back that have, you know, training and all these extra things that they get paid for. What are they really being paid? And we do that for a lot of our cities, so we can have that discussion, Senator, if you'd like. So, are we comfortable?
I would like to make a motion to adopt Curative as our insurance company for our employees.
Second, because you beat me to it.
May I ask for one clarification?
Oh, yeah, and I would also like to add that we use Mutual of Omaha for dental,
Vision,
vision, yeah,
long-term.
yeah.
The recommended.
So as presented for the dental, life, vision, short-term, long-term?
Yes.
Okay.
Yes.
The one clarification that I would like,
EPO.
somebody said that.
EPO, correct?
Yeah.
Yes, and
EPO is the
EPO would be the baseline.
Okay, thank you.
Yes.
I just wanted to make sure.
Before we, Mr. Foster, I'm just trying to, I want to make sure this is right. So I know, like, for health, you're asking for the Curative EPO. For the dental, you're asking for Mutual of Omaha, and there's only one plan for that. Vision, there's two plans, and Plan 1 of Mutual Omaha is actually the cheaper version. And then the life, the base life, Plan 1 of Mutual Omaha, and then short and long-term would be Mutual of Omaha. Did you want to add the MESA, the MASA, that he did ask about?
Ambulance service. The city currently pays for CareFlight at $2, so it would be $5.
So with all of that, I mean, you probably should say all that again.
Can I state it for you, since I think,
Yes, but I would just wonder, Vision Plan 2, what was the difference in price between, because it was like,
Oh, that's the one you want?
Yeah.
Okay,
option 2 enhances the benefit at same cost.
same price, that's what, yeah. Yeah.
okay.
Yeah, go ahead and state it, and then I will agree.
Well, AI, your voice over my words, they're perfect. So the recommendation, as I understand it, is a curative triple option with the EPO as the base plan that is funded by the city, transition all ancillary products, dental, as quoted, vision option 2, basic life, as quoted, voluntary life, which your employees pay for, long-term disability to match current, short-term disability as a new city-funded disability program, MASA ambulance service at $7 per employee per month. If employees wish to buy the additional for their family, they may for 10. And then the new benefits Teledoc program at $8.50.
So move.
Yes, second.
So,
Thank you, I appreciate the questions.
you're welcome. So a motion has been made by Councilman Rofosa and seconded by Councilman Chucky Easley. And I'd like to, I know you had a discussion about it. Do you want to add anything, or?
I did have one question for our HR director. I know I'd heard that we had partnered with the gym next door, and I just wanted to see if that was still in place and if that's part of the ongoing partnership with, and in the fitness of our, our staff. Is that still happening and will continue?
Absolutely, that's a
Okay.
wellness program that we have implemented and partnered up with Advanced Fitness.
Okay.
Our employees, I don't know the number count, but some are taking advantage of that. And I believe October is our next bill, which I have in the budget, I believe, so we should be good.
Okay, and I'm just asking because I wanted to, obviously a fitter, more, agile team makes for lower costs. So, if we can just keep that happening, we'll be good.
Yes, and it's a discussion thing here, very quick. So is it possible for, I know this fiscal year, once we give you, we approve this, is it possible next year, if you're going to help us be able to have more options? I know you have given us quite a few. And I'm just speaking this because of the taxpayer out there. This is a very thorny issue out there, even though sometimes we want to keep the employees' morale. Nobody wants to see any cut, but we want to balance the needs.
We can provide the data.
Oh, okay, so then I'll be glad to look at the data.
I'll provide it to HR.
Okay, thank you. So a motion has been made by Councilman Rob Fossa and seconded by Councilman Chucky Easley. So I'm going to ask for a vote. Those who are for this motion? Anybody against? Passes unanimously. So we are going to go to item 7, and thank you very much.
Thank you.
We are going to go to item 7B, review and discuss and consider the creation of City of Keene Employee Benefit Trust Fund by authorizing the trust agreement establishing the fund and naming of trustees, and the passage of resolution stating the City Council's establishment of the trust fund.
So I'm actually going to handle that one for Sandra. When we first started working with the city, one of my first questions to Sandra was, do you have a single nonprofit trust in place at the city of Keene? And the answer was no. So what is that? Chapter 222 of the Texas Insurance Code allows for the premium taxes to be removed from your premiums and sent, not remitted in your case because you're a large employer or middle market employer. So what does that mean? Since 2005, you've been paying an extra 1.75% in cost every year that you didn't have to pay. So I was one of the first brokers in the state of Texas to do this. So it's actually our document. So what we're presenting to you is we by resolution, council passes it. We do not have to have a separate bank account for a trust. It just needs, your program will be called City of Keene, EBT, Employee Benefit Trust. The purpose of that is the controller, the state controller's office has to have the trust document in hand so that Curative, in our new example, does not have to remit premium taxes to the state controller's office. So when they adjust the rates, they don't have to pay that tax to the state of Texas. And so the city of Keene retains that money. You don't pay sales tax on anything else. Why are you paying it on your insurance? So we're putting that in for the city. So that's what this is. We are not required to open a separate bank account with trustees. The purpose of it is by name, single nonprofit trust. That's its purpose. And its one purpose is we'll have the premium taxes removed from your medical, your dental, and your vision plans. For your life and disability, 1.75% of 13 cents does not move the needle. So if you have questions, glad to answer them. You are the only city, the only county that I have that does not have a trust. Yes. Oh, on annual savings, thank you. It's $17,500 for every million. If that helps you with the math.
Well, that's easy math. So I make a
I'm
motion
not
that
great at math, but I can do that.
the council authorize the trust agreement establishing the City of Keene Employees Benefits Trust Fund and naming trustees and the passage of the resolution stating the council's establishment of the trust fund.
I second.
Okay, so a motion has been made by Councilman Rob Fossa and seconded by Johnny Shaw. Is that correct? Yes. So any discussion? So I'd like to call for a vote. Those who are in favor? Anybody against? Motion carries unanimously. Thank you.
Thank you.
Thank you.
Thank you very much.
Thank you for your professionalism, appreciate it.
And I
Thank you.
I would like your card so I can give it to my boss at work.
Perfect. Thank you. Y'all have a great evening.
Thank you. Okay, thank you. So we'd like to move to item 7C, and that's review, discuss, and consider a resolution approving a list of 14 holidays in which the city offices will be closed.
Bear with me, I have my stuff out of order, so my apologies. Proposing 4 additional holidays. This is going to be something that I would like to move forward with. We have significant historical events throughout the year, figures, traditions, American history, culture, patriotism, civic pride, and so forth. We currently have 10 paid holidays. The 4 additional ones will be President's Day, Juneteenth, Columbus Day, and Veterans Day. This is something that has been brought to my attention from other employees as well, where, why aren't we closed? What's going on? What's happening? We have little to no foot through the front doors, reference payments and so forth, and this is something that I verified with our utility billing clerk. She does receive calls and they say, well, I didn't think you were open, this is why I didn't come in. So this is just something that it would also bring up employee morale if we were to move forward with this.
Go over those 4 additional dates again, please.
So President's Day, and I believe that is in
February 17th.
February. Let me see. I'm a little nervous, so pardon me. Ronnie did all the talking, so I just sat there. So we do have President's Day, which is the 3rd Monday of February. Next is going to be Juneteenth, which is going to be, of course, June 9th, yes. And then we do have Columbus Day, which is October. And then, of course, Veterans Day. Let me speak a little bit about Veterans Day. I was really surprised in a good way. We have several employees throughout our city that are veterans. Our fire department, our police department, Public Works. We also have, here at City Hall, of course, Council Member Shaw as well. And we do have one active reserve as well. So, this speaks volumes. You can go through our city, beautiful flags going down the highway that's provided by our chamber. Very patriotic. Let's celebrate that day.
I would like to see us do at least President's Day, Veterans Day, and actually New Year's Eve is one that we do not recognize right now. Not a big fan of, and I'm tracking based on the list that you gave us.
Yep.
And if I was looking at Columbus Day, even on this side of the sheet, there is nobody that has Columbus Day, and only 5 on the other side. Nope, I'm sorry, there's quite a few on the other side. But I would not,
About that, so thank you for
I would do,
reminding me.
I would do 13,
Okay.
13 holidays, and that's still a morale booster. And actually, it ends up putting us, like right now, we are at 10 holidays. And if you look at the max, there's 16, but the average seems to be right around 12 to 13 holidays per city. And I'm not trying to be comparative, but when you have a wonderful sheet like this to go off of, you don't have much choice. So, but I would like to see those 3 added to help boost morale. I do like your point about the Veterans Day, even though I understand that some of our police and fire cannot take that day off because of their duties. But to give our employees the best option available to take a little extra time off to be with their family, go take care of some things. Unfortunately, still can't visit a bank, but it is what it is. So, but I'd like to see that.
Councilman Smith, are you saying take Juneteenth out and add New Year's Eve then?
Correct.
Make it 14?
No. So instead of her list, I was just creating my own. So I like President's Day to be added, Veterans Day, and then also New Year's Eve. And those are typical ones that you would normally see at even just regular businesses.
Okay.
If you look at the sheet that was provided, and with all due respect, sir, I like your list as well. I like to celebrate New Year's Eve as well. But looking at Juneteenth, this is just something that, moving with the times, and I would highly recommend that.
So I have a question.
Oh, go ahead.
Yeah, just go ahead.
I was going to speak up to you. So what you also find during the holidays, because so many holidays back up to each other, you already find typically that if employees want it off, this is when they're going to take PTO, because if you take 4 days off, you can have 9 days away. You know what I mean? So if you add another day there, now they're taking 3 days off, and my fear from where I sit is there's going to be a lot of people, even more, taking off, you know what I mean, and making it kind of a little bit more difficult. So, and I would agree with the Juneteenth comment. I mean, that's, with the times, that's that's kind of an important holiday these days. So I think it's important it's recognized. So that's just my 2 cents.
So if, can I rebuttal to that real quick?
Yeah,
Sorry,
go ahead.
I'm just trying to, so I'll give you my synopsis of how I came up with this, just off the cuff, is I'm looking at the months and how they're scheduled out. And of course, you've got all these holidays in here. We have like Memorial Day that we all know that we take off. We take off 4th of July. And so there's like a 1 month period in between there. And then now you're asking to take off Juneteenth, right? Which puts 3 holidays within about 33 days worth of a cycle, right? So to me, I feel like that's a little excessive, and it has nothing to do with June 19th or the premise of the holiday. But I do know that most other companies that are out there, one, it's brand new. It's only 3 years old, and so it's not as recognizable as some of the others. And I mean, we could honestly say, hey, why isn't Cinco de Mayo on there, right? Even though not one person is on there.
Say, go for it.
You know,
Margarita Day.
it actually shows that there's 1%. So it has to be a city that is attached to the southern border of Mexico where they're like, we're taking that one off. But I'm just saying, like, we can pick any one of these and have a debate of yes or no. And I'm just trying to, in my feeble brain, I'm just trying to space these out accordingly so that way it's not a large amount of time off in a short amount of time. So I'm just trying to spread them out. So thank you.
Thank you.
So I had a question. I know there are some cities here that have already in their books around 16 holidays, and those are like almost 2 cities. That's city of Angleton,
Angleton and Liberty.
and then the city of Liberty, Liberty Hill. And then most of them are 15, city of Bay City. We have 14, we have 13, we have 12. So I'm just trying to look at, you know, everything has some kind of impact. There's a dollar sign attached to something. You know, any decision that we are making as
There's no financial impact on the holidays.
yes, and this is why I'm saying it. Yes, the financial impact, I'm talking from the residents' point of view, in that some of them will expect service on some of these holidays, and we might be very generous and say we want to take 16, we want to take 18, why not 20, why not this? So we can choose that, but from having talked to majority of the residents here in person, we have, most of our residents are seniors.
Okay.
And some of them prefer to come here and transact business in person, even though you have online, you can pay through using your debit card and some fees attached to it. Some will prefer to come here and pay their bills and go home. And that's the thing that might be a concern, even though the cost, the city might not have the cost impact directly, but in terms of inconvenience, because the reason why people have government close to them is to get service, so that they can, if they have a problem, they'll come here, speak to the city manager, so by having more of these holidays closing the city hall, what will be the impact to the service that will be provided to the community?
I understand your concerns, and I appreciate that. We are here for our citizens. This is why we are here. This is why we have a job, because of them. I have confirmed with our utility billing clerk, and she has stated that there is little to no activity during the said holidays that has been presented, because there's an assumption that it's a federal holiday, therefore banks close, post office is closed, therefore the city is closed. That's the feedback that I received.
Okay. So you're saying based on the traffic, we don't have as many people coming in on these holidays that you're recommending?
Correct.
And you're saying there's no cost impact on the city side
Correct,
by taking off those days?
correct.
Okay, thank you.
Any other questions? Yes, sir.
I move that we take your 3 holidays or 4 holidays or whatever you want to add to it and add Mr. Smith's and just make it 14 and go for it.
Oh.
15, 14, 15.
I'll second that motion.
Okay, so a motion has been made by Councilman Johnny Shaw and seconded by Councilman Bob Chapman. And any discussion? And I'd like to call for a vote.
Sorry, just to clarify, I just want to make sure we're all on the same page, that we're asking for, that you're asking for 15 days to do the 4 that she recommended, and then the extra one that I recommended, which the only one that was different was
The New Year's.
New Year's Eve.
Yes,
Okay, just checking.
yes. Because HR wanted 4 more added, and you would like New Year's Eve added. I only get 2 a year, so it don't matter to me. We're open 363 days a year. So I think it would be good for our employees. We can add it. There's always emergency services that are on call all the time. So if something was to happen during one of these holidays, they could contact the city and get emergency services out here, and they could round up people if they needed to take care of whatever situation arose.
Okay, and we have Ray Johnson.
Oh, pardon me, I'm sorry, go ahead, sir.
You're fine, young lady. I work for TxDOT, I work for Fort Worth,
What's your address, sir?
1009 Ray Johnson, 1009 Christine Street, Cleveland, Texas. The thing I'm trying to get to, I'm with them, I mean, the holidays, somebody's gotta be, really the people on duty, fire, police officer, they're here. Public Works, you make a phone call, they got a number you call, they show right, I mean, I'm gonna tell you from experience how they do. You call, I called them at 12:30 one night about my house, and they were there in 30 minutes, man. So, I mean, Public Works is the only one you gotta worry about, and you ain't even gotta worry about them. But it ain't gonna, I mean, every holiday, people, either they gonna come the day before, if they know they're gonna close, or they gonna be here the next day. You know what I'm trying to say? That's the way you got to really look at it. I mean, it's gonna be there for the people, but they need, I mean, they need some time off too. I mean, they work all the time. I mean, I'm the first to tell you that. I mean, you know how I rag them out, but I'm gonna be honest, they need time off. That's how you need to look at it.
Okay, thank you. Anybody that would like to talk about this?
So I'm just gonna be real honest, and I am gonna tell you that I am gonna vote no on that, because I don't wanna see it go more than 14. Just for the premise that the average isn't even 14 days. And I'm not, it has nothing to do with trying to say, you know, no, you must come to work. It just has everything to do with the amount of holidays that are that are so close to each other that I feel like it's a little overdone. And I think most of the companies nearby, like the one my wife works for, it's 12 days off. And each year they actually just go, they sit at a table and they say, which ones do we take off this year? So you get 12, so you pick which ones, right? And it's kind of a consensus from the higher ups people, and she's one of those, right? So she gets to help decide that. And so, and that's what they discuss in there is exactly that. Do we want, you know, because we all know, just like what Mr. Seitz said, is a lot of times people plan those 3-day weekends plus take a few days off, you know, and so there's already going to be some overlap, and then you'll have 2 weeks later and another day off is available, you know, if we choose this. So that's all I want.
It sounds like they look at where the holidays fall within the calendar. if they do it every year. What I'd like to bring your attention to is the percentages at the bottom.
Yeah.
And those percentages is the percentage that that holiday is utilized as a day off. Columbus Day is only at 23%. New Year's Eve is at 4%. So just think about those, other cities, that's what other cities take. So, but President's Day is at 60%, Juneteenth is 63%, Veterans Day 64%, those three for sure.
Yeah. Well, and so I will say that, yeah, like just the argument I made, you know, and I'm sure, think about it this way, you know, the people that are in that room discussing it, you know, they're saying, well, I have vacation coming in Christmas time, and so of course they pine for that because it's not going to affect them if they have one more day off, right? So, I mean, honestly, I could care less. I just don't want to see it go over 14. So, is all I'm trying to say.
And since everybody else chimed in on this, I'm kind of out on Columbus Day. I'll go with the rest of them, but I don't know that when the last time, I mean, to be honest, my dentists work every day except 4th of July. They work through those federal holidays 90 miles an hour. So I could go with everything except for Columbus Day. I'm out on that one.
I could do that too.
Okay. Sandra?
Yes, sir.
What's the big deal with Columbus Day?
America was founded. I mean, that's some basic.
Well,
so.
I understand that part of it.
We got a history lesson coming,
Not
folks.
technically,
Be
he didn't
ready.
find America, he found the island.
Right.
Well, some of them still ain't found.
We don't want to be.
I will amend my recommendation.
Yeah.
What?
Well, you need to call for a vote first, because it had a second.
There's a motion on the floor, but I think he can amend it.
That's what-
If he's willing to amend, then we can.
If he's willing to amend it, he can do it before the vote.
Okay, I amend my motion to withdraw Columbus Day from the mix. Total of 14.
So we still have 14, yeah.
Do we need, for clarification, do we need to rattle them all off so that way we know exactly what we're doing for a motion?
Well, Sandra asked for President's Day, June 19th, Columbus Day, and Veterans Day, and you suggested New Year's Eve.
Correct.
So we will do President's Day, June 19th, Veterans Day, and New Year's Eve, New Year's Eve.
That's the new motion.
That's the new motion to move forward on, yes.
Are you still good with this? No, Mr. Chapman did.
Certainly, I'm good with that.
There you go.
Okay, so the motion has been amended, and the motion has been made, a new motion has been made by Councilman Johnny Shaw, and seconded by Councilman Bob Chapman. Any discussion? So I'd like to call for a vote. Those who are in favor? Anybody against? Motion carries unanimously. All right, thank you. So we are moving to item 7D, review, discuss, and consider approval of proposed update to the Keene personal policy. That's 3.5, promotion and transfer, and section 5.1, holiday leave.
Yes, this is going to be a revision from a 3-month probationary period to a minimum of 3 months probation period. You may have an employee that 3 months probation, he's good to go. You have other positions within the city that may require a little longer, 3 months, 6 months, even up to a year. And that's basically just changing the verbiage to a minimum of 3 months, and then let the department head go from there, let them decide how long their probationary period should be.
You say this is for the department head to make that decision,
Correct.
whether he feels somebody's needs a little bit extra
You
attention.
know, as far as a clerk may be on probation for about 3 months. you may have somebody in the fire department that's gonna need a little longer than the 3 months.
I understand
So it'll
that.
be up to the director to decide that.
Pardon me, is that just too discretionary to do that?
Well, with our first responders, it'll be up to them to decide as far as the training that goes on. You may have someone that's coming in as a firefighter that's promoting into an engineer. That training there is going to be a little bit more intense versus someone that's going from one clerk position to another accounting position. So, yeah, absolutely.
Good evening, Mayor Pro Tem, Council, City Manager, and citizens. What she's looking at is she's asking for a change to the city's personnel policy manual. That is an overriding document, and that those are policies that we must all follow, every employee. Now, each department has their own departmental policies as well, and they can even be a little more strict as long as it's approved by HR, city management, and in certain cases by council. So this, the way it's worded, is that there would be a minimum of 3 months probation. That applies to perhaps 40-hour personnel, maybe in promotions, if we ever move to a lateral transfer or something like that. It doesn't take as much time before you know that they're going to be able to do that job. Myself, in the fire department, I have a departmental policy of 1 year. The reason I have it set at 1 year is because they work 48 hours on and 96 hours off, and there are times when I may see them once inside of a 3-week period. So it's really tough for me to determine if they're capable of doing that job to the extent that I expect, and then I need a little more time than those 3 months.
That makes perfect sense. Yeah.
Thank you.
Thank you.
Thank you.
You said it a lot better than I did. And the rest of it is just cleaning up some of the verbiage as far as just making sure that everything is just cleaner. But the main revision is going to be implementing the word minimum in there.
This probably is a question for you guys. Right here, we have a resolution to pass, and of course, we just changed the holidays and we didn't include Columbus Day. So is it fair to say that we should probably get a rewrite on the on this resolution, or can we amend our resolution now and have it added into that before it's?
We'll have it added in, and then it'll be on consent next month.
Okay, so is there a motion to be made, or are we just giving direction?
I think probably to do a motion just to be safe.
Okay. Go ahead.
So if anybody doesn't have any discussion, may I have a motion?
I move that council approve by resolution the updates to section 3.5, promotions and transfers, and section 5.1, holiday leave to the Keene personnel policy.
I second.
So we have a motion on the floor made by Councilman Rob Foster and seconded by Councilman Johnny Shaw. Any discussion? I'm calling for a vote. May I see those who are in favor of the motion?
I have a question real quick. Sorry, I was trying to put my hand up, but I was reading something. Do we need to state that we changed that holiday, or can it just be something added to? Okay, but it doesn't need to be in this motion, is what I'm trying to get at, in order for it to enact?
No, it's,
As-
it speaks to holiday leave, so whatever
Okay.
we set as holiday, that will be the holiday.
Okay. I'm ready to vote now. I just wanted to be clear that we're doing things right, sorry.
Yes. So I'd like,
Sorry, I just saw something on my notes. Just be aware, fire, September 11th, Texas Government Code 142.0013C. That's a holiday that is given to them no matter what. So to be equally fair, the rest of the employees will have a floating day.
So in lieu of that, do we need to go back to and re-amend our
I
motion
think
from the
that's
previous
fine.
one?
I don't know, let me see if that's in the,
Or, Sandra, do we not?
I think floaters are just automatic, I mean, that's nothing we have to vote on. It's already in there.
okay. Are we good? Okay. I just want to make sure, I just want to be very transparent. Okay.
Floaters in there because our motion was that they'd have 14 holidays. We just added one more. We didn't, the state.
Well, for the fire department, that's
Yeah,
a
but
must.
then if we have to add the 15 for the floater,
And why do we have to add a floater for the employees?
To be equally balanced, you know.
Or do you do a, fire department doesn't get one of the days off they just said? Because then it's equal that way too.
They get them all. They're
They
working
can,
any-
they can work Juneteenth.
Just kidding.
Do I need to?
We work every day.
Exactly.
Do I need to, this, Of course, it's the last item that we wish the attorney was here for.
Do we want to table it for clarification?
Yeah, I think it's probably best.
Okay.
We table this last one just for clarification. I can reach out to the city attorney and just make sure.
I just want to be
Sounds like we're
transparent,
all
yeah.
on board.
Yeah, I don't want
Yeah.
the citizens
We wanna
feeling
nail
like
it
we're
down.
trying to pull a fast one.
Right. No, I just want to be very transparent. I don't,
It's
yeah.
about time those came over here.
Okay. But yes, I just want to make sure that fire department is taken care of. That is Texas code.
Okay. Well, I want to thank Sandra. And quite honestly, I would like to, thank Sandra and Rodney
Yeah,
for,
Right.
I think you're seeing the benefits of having stability inside your city hall. You know, I'm seeing momentum pick up, things getting done that have been on a list, for a long time. And I also kind of want to speak just briefly to the fact that although you haven't seen the official proposed budget, we realize there's a lot of objectives that are worked into what I call an actual working budget. So we know what dollars are actually being assigned to actual projects versus just, well, it's in there somewhere. And I want the citizens and the council to hear that even though it hasn't been approved, you know, we are starting to have those conversations of when budget does get passed, you know, how do we implement these things and actually get things done for the city? So, and I also want to applaud council. You know, tonight was very employee benefit heavy. And I want to, again, like I've said many times, I want stability for our city. And so these decisions that you made, I was honestly very pleasantly surprised about the holiday pay. Again, coming from the healthcare industry, much like, you know, Chief Warner joked about, we work every day, that's where I came from. Holidays actually meant I was going to work harder because that's the day everyone wants to call in sick. And so you guys making what seems like a simple decision actually helps. And again, with these decisions, this is how we recruit good people and this is how we keep good people. So I want to thank you for, you know, not having the conversation of, well, how do we've saved money, let's not try to cut and hurt the employee even more. Instead, you guys really looked at how do we continue to build the stability for our city. So I just want to thank you for partnering us and doing. So I want to thank you. It means a lot.
So, council, based on that item, I'll just, if it's okay, if I can call a recess for 10 minutes, so that either you can reach out to the city attorney regarding that, if we need to table it, or we need to,
We were just going to table it till next time.
oh, okay.
Yeah.
So, but I'd like
I
to,
want to call the attorney this time of night.
okay, but I'd like to call for a recess for 10 minutes, if that's okay.
Oh, this is the last item,
This
isn't
is the last item.
Yes, I'd like to use the restroom.
Oh.
All right. So I'm calling for a recess for 10 minutes. and we should be back by 8:30. Thank you.
No, that's just, I have to.
I think we need to go back and actually say, I'd like to make a motion to table. Yeah, because right now it's just a discussion and we haven't done it. And there's still a
Sit down.
I'm sorry, man, didn't mean that. It's all good, brother.
I'm ready.
Hey, wake up, man, they're waiting on you.
Almost.
Got a dollar waiting on a dime here.
May I call the council to order, and we are back from recess at 8:30 p.m. And we are going to go back to item 7D
And I
for
would like to
discussion.
I would like to withdraw my motion.
May I have a second?
I'll second.
Any discussion?
I'd like to make a motion that we approve the resolution to update section 3.5 promotions and transfers.
I second.
So we have a motion on the floor by Councilman Rob Foster and seconded by Councilman Johnny Shaw.
Let me clarify that. It's motions and transfers of the Keene personnel policy, I guess I should say.
Okay.
And I still second.
So we have a motion on the floor, and I'd like to call for any discussion. If there's no discussion, I'm going to call for a vote. May I see those who are for the motion? Against? Motion passes unanimously. Thank you. We are going to move to item 8.
Whoa. I'd like to make a motion that we table section 5.1, holiday leave for the Keene personnel policy.
Second.
Table until the next meeting.
So we are going back to item 7C.
No, second part. So we just did 3.5, now we're doing section 5.1. So that's what he split.
Okay, 5.1.
Motions on the same,
So that's 3.5 and 5.1.
3.5 was passed,
Yes.
5.1, he's wanting the table. There you go.
Okay. So we have a motion on the floor to table item, section 5.1 by Councilman Rob Foster. And who seconded? And seconded by Councilman Chucky Easley.
I kept quiet.
Any discussion? I'd like to call for a vote. Those who are for it, and anybody against? Motion carries unanimously. Thank you. So we are going to move to item 8, executive session. I don't think we have any item for executive session at this time. So we are going to move to item 9, which we don't have any action to take because we don't have executive session. And then we are going to move to item 10, requests for future agenda items. So there is already 2 scheduled for 9, that's for 2025. And then there are 2 items here, review of ordinance section 772.10, which was tabled back in 8/7/2025 meeting. Discussion on presiding officer if mayor and mayor pro tem are both absent. So any other item that you might want to add to this? Okay, so then we'll move to item 11, which is what we have been waiting for. And may I have a motion to adjourn this meeting tonight?
Just hit the gavel.
I make a motion to adjourn.
Second.
So motion has been made, and We are adjourning this meeting at 8:34. Thank you.